Hi, everybody. I'm Dr. Radlisha Sneed, and I'm an investigator with the Church Challenge. In today's Health Policy Church Chat, we'll talk to Dr. Kent Key, who was instrumental in bringing forward a resolution to recognize racism as a public health crisis in Genesee County. He'll be interviewed by Pastor Lessie Lee. Thanks for listening, and we hope that you enjoy.
Hi, everyone. My name is Pastor Lessie Lee of the House of Capernaum Deliverance Ministry, located 3432 West Pasadena Avenue, right behind the Great Bountiful Love Ministries. This morning, today, we're going to conduct an interview with a great prominent figure here in our community. He done put in a lot of work. I've been following this individual for a long time. He don't remember the first interview that I followed, that I was president of here, is that a presentation at the Odyssey House way back in 2011. And then he was talking about how our people was brought over here and things of that nature, and how we've been up under discrimination and racism ever since then. But today we're gonna flip the script today. He has conducted a lot of research, and his findings has produced him to come to the conclusion that racism has been made a public health issue. But we're going to hear from Dr. Key this morning and tell us what research he has conducted and how did he come to the conclusion of making this a public health issue.
So good morning, and I'm so happy to be here. The actual title is that we've declared racism as a public health crisis. I tell people quite often here in Flint, we have, four main crises happening at the same time, right? We have a water crisis, a democracy crisis, which led us to the water crisis. We have a racism crisis, and then we have this global pandemic. And this racism crisis is not anything new. It is definitely something that events and current events continue to kind of spark interest in when we think about Breonna Taylor and George Floyd, and how it created an uprise of young people, especially across all races and ethnicities, to take to the streets, to do demonstrations. Some lasted for months. And just looking at the systemic nature of racism and how it has been playing out, not only just in law enforcement, but across systems and sectors in this country. The work of declaring racism as a public health crisis comes from years of looking at racial and ethnic health disparities and looking at the social determinants of health, things like redlining that historically created segregated neighborhoods. And then we know that the next predictor of life outside of your genetic code is your zip code. It's where you live. And we know that those things have been manipulated by racist policies and different governance and structures that have been put in place to keep certain people in certain areas by race and by economics. And so declaring racism as a public health crisis was something that was timely, and it was something that would allow us to look at racism not from individual experiences like we normally have in the past, not because maybe Dr. Key or Pastor Lee has had an encounter with a law enforcement officer or a racist encounter with someone as individuals, but it allows us to look at racism from a systems perspective, because public health affords us the ability and the models and the frameworks to look at systems and then the intersection of systems.
Thanks for that wonderful response there. So let me ask you a question. Like when you was talking about racial disparities as well as redlining, we fair well know that just like with the pandemic, we see that when we're talking about racism, I'm just gonna personalize it and call it in the Black community. Mm-hmm. And so a lot of times when different things transpire in the communities, as far as like in the pandemic, that by racism as well as discrimination being high on the magnitude, do you think that the African American population is receiving the proper health care as well as the proper research information when certain things are transpiring?
So that's a loaded question. I don't think we as a marginalized community has never really received proper health care. I think there have always been factors and barriers to that, whether it was economics, whether it was literacy and understanding what the medical provider was saying. I think there and very many other factors around that, even just being the cultural mistrust that African Americans have had with what we call medical mistrust because of being African American. And so I think that there are a lot of factors that help us, that prevent us from receiving not only the type and quality of healthcare, but even having the right access, if you will, to healthcare. And so when things like the pandemic comes and people are talking about the COVID vaccinations, then of course there is still that pathology and that historical memory of events when the medical community may not have been the most ethical towards the African American community and towards other marginalized communities. And so when we think about that mistrust, then it's no wonder that people are questioning whether they should take the vaccination. And of course, I encourage, as a public health professional, all to take it. I'm going to take it, but there is no wonder why there is still hesitancy and why there is still somewhat fear and apprehension in doing so, because the federal government has not always been straightforward with us. But the thing is now, you know, when you think about back when Tuskegee, and people always say Tuskegee syphilis experiment, I always call it the public health syphilis study because it was by the government. But since that time, we have put some different types of mandates in place to ensure that human subjects are ethically treated fairly and that they are treated in a just way. So we have now internal review boards, we have data and safety monitoring boards and other mechanisms that have been put in place. And now you see more people of color. We're still underrepresented in most medical and public health professions, but yet you see people of color who are also a part of these boards to ensure the cultural competency of the work that these boards and the safety precautions that they are designed to bring about.
Thanks a lot. So let's go on to our second question. How did you put the resolution together? Did you have any help? What steps did you take?
Sure. So I have been working on the resolution for probably about a month. And then I actually, once I got the body of it together, I tapped into one of my friends, Naira Sharif, who kind of made sure everything was right and in order the way it needed to be with grammar and the way it was organized. And what happened was I was serving on one of the COVID task force, and I saw an opportunity to really elevate this declaration. Now, there had been a couple other states. There was one state and a couple of other municipalities that had drafted similar resolutions across the country at the time. And so we drafted this one in June. And literally it was really kind of replicating some of the steps that I had utilized when we got health in all policies, or health equity in all policies, declared as a resolution. And that was in 2017. And so we got that done and we got that declared. And so I pretty much just kind of used the same kind of process that we did with that. But Naira Sharif was one of my co-authors that made sure that I had everything in place.
I'm glad you stated that, because me personally, I have a lot of work that I want to present, but I've been procrastinating because I've been struggling with grammar issues and making sure and I'm hearing from a prominent doctor that he had to have his work, you know, edited by someone else. So I just want to let you know, you just encouraged me today on to start, you know, bringing somebody else on my team to start editing stuff. Because, you know, when you present stuff, sometimes, you know, you want to make sure everything is on point. You done dotted all your I's and crossed all your T's. And, you know, one of the worst things you want to do is get up there when you present it in front of a conglomerate of people and you pronounce the words wrong. You know, you're not presenting, your sentence is not lining up. So I just want to thank you for that encouragement to build a platform in that area.
It's just standard practice. I mean, no matter what level of education you have or what degree you have, you know, especially when you're working on multiple pieces, whether it's a legislation or resolution, you could be working on a grant or a report. When you're doing a lot of writing simultaneously, it's always good to have a fresh set of eyes to just kind of go over. That's just human nature. You know, even in college, you would do that with your reports, ask somebody to kind of proofread for you, because
Exactly.
just the human body, after so long, it sees what it wants to see,
That's
even
right.
though that may not be what's on paper. So yeah, it's just standard practice.
That which leads us into our next question. What was it like to present it in front of a board of commissioners?
Yeah, so actually it was taken first before the Board of Health, the Genesee County Board of Health.
Okay.
And so it was unanimously passed at the Board of Health, and then a couple of weeks later, or either a week and a half later, it was then moved to the commissioners' agenda.
Okay.
And so this time it was a little different because everything was virtual. When we pushed through the first resolution declaring health equity in all policies, we were in person. So this time it was a little different. Even community members who wanted to give support during public comment, that was different. So I had to send the information out through my listserv to hundreds of community partners so that they can either send emails in, or they had to call a number, right? And then when calling a number, they were prompted to leave a voice message as their public comment, as opposed to showing up in person and doing so. And so that was a little different. And again, hearing it read in front of the Board of Commissioners and having that back and forth question piece, or that conversation dialogue, was a little different again, because I had to call in via either the phone or either get on via Zoom. And so that was a little bit different, but it was a good experience. The commissioners, majority were very supportive. I think it was only 2 commissioners. We passed, I think it was like 5 and 7, or either 7 and 9, I can't remember, but it was only 2 commissioners that were not totally in support of it. But for me, it was very important that we passed this resolution in Genesee County. Now, shortly after that, the city did theirs, and then also eventually Governor Whitmore did the same declaration by executive order. But the importance for doing it in Genesee County for me was that if we only did it in Flint, I mean, Flint is majority minority, right? Majority Black. But Genesee County, we're not the majority. We're like maybe 35%, or around 30 to 40%, if that. And so it was important to do it on the county level, because that's where we see the most integration and the most opportunity to even impact conversations around race and racism.
That's great, because that you answered our second question. Were there any commissioners who opposed to the resolution? Do you know that, like the ones you said that opposed it, the
Yes.
2 that opposed it, do you know what issues they had with it?
Yes, I actually had dialogue. One of the commissioners said, well, this is all happening too fast.
Okay.
Right? Why is this happening so fast? We need to take our time. I really feel like they wanted time to kind of get, support from their areas who may have different viewpoints or whatever. But regardless, they felt like it was just being rushed. It was too much happening, because remind you, this is in June when all of the protests are going on. This is like in the heat of the whole thing with George Floyd and Breonna Taylor, and everybody's marching every day across the country. It's all on CNN every night, right? And so my response was, well, we have had over 400 years to address racism. What do you mean we need more time? How much more time can we give? We've had 400 years and we haven't come to a conclusion. So we don't need more time, we need action, was my response. And then the other commissioner said they didn't think it was public. They didn't think that racism was a governmental issue. And so I was kind of floored for a second. And then my response was, well, clearly history and civics may have been something you didn't, that they skipped out on, because racism is founded in this country by government. It was
Right.
in the original U.S. Constitution that slaves were considered 3/5 of a human being. They were considered
Exactly.
property or chattel. So government birthed this concept of racism in this country. So therefore, it is going to have to be government and others and other sectors. But the government is definitely needs to be at the table in eliminating and eradicating racism from this country.
Yes, because I was, you brought up protesting in the middle of June. My fraternity brother, which is Dewan Robinson. I done seen you and him. Matter of fact, I attended the event that you and him had put on down at the G Card. Y'all had I think it was in the evening that y'all had
Oh,
event.
so it was a group, it was a larger group, and we were doing a study around trust. What
Yes.
level of trust did the Flint residents have in government and in institutions because
Yes.
of how the water crisis happened? I know exactly what event you're speaking of.
And I attended that event, so I've been, like you say, I've been a lot of your audience, and I'm well pleased about the information that you present to the audience. And so so when you're talking about the protesting, do you think that a lot of things, when you was bringing your information and when you was trying to get your resolution passed in law, do you think that they was looking at, here's another radical, due to the fact that you were African American, do you think they was kind of look at, here's another radical individual coming trying to get something passed real quick, and they need our support, so we might want to take time to view this? Did you look at it, measure it from any point of view of that?
I don't think I had that particular type of frame. I think the frame from which I viewed it was, one, we had the facts, right?
Okay.
In the data across racial disparities, economic disparities, across health disparities, economic disparities, education disparities. I mean, you can name them. Housing. Race has always played a prominent role in those who are disproportionately impacted. And so we had the data, we had the facts. And so I didn't even take energy or interest in noting what they thought, as opposed to, here are the facts. This is where we are as a country, and this is where we need to go in the direction to solving the solution. Was really just my mindset.
So you tell us a little bit, how did the voting process work, and what was simply a majority vote?
So the voting process was, the resolution was presented and read. It was discussed. There were questions and answering. There was also time and availability for public comment. And then there was a vote taken, literally. And that was the same for the commissioners, the Board of Commissioners, as well as the Board of Health. And again, we had a unanimous vote with the Board of Health. And we had actually one of the commissioners who was on the Board of Health that voted for it there was one of the ones who did not support it when it went to the Board of Commissioners. And I think that's because that person had a little backup with another person kind of feeling the same way. Mm-hmm. But it still passed. The majority voted for it. It was only two individuals who did not.
Okay, thanks a lot. Now that the resolution is on the books, now what? How does it become a living document?
So we are now, since that time, I have galvanized efforts to operationalize the resolution. It's not enough for it just to be in black and white on the books. How does it become real, right? And so what I've done is I took that resolution to one of the subcommittees of the local task force on COVID and racial inequities. And that faith community, that faith group, it's one of the faith groups with a lot of faith leaders on it. I'm on that subcommittee as well. And so we were talking about the role that the faith community plays in impacting marginalized communities. One was around racism, and specifically, what role can the faith community play in creating effective dialogue with law enforcement and with the Black and Brown community. And so they already had an agenda to address race and racism. And so they wanted to support the operationalizing of the resolution that I had authored. And so since that time, I wrote a proposal to get a small grant from Robert Woods Johnson. as well as the group, we worked together and wrote a proposal in partnership with the University of Michigan, Flint, Dr. Lisa, and we were able to get a grant from the University of Michigan Poverty Center. The purpose of the grants are to create a community action council that would have representatives from every town, township, municipality in Genesee County, across sectors, across ethnicity, across employment status and education status, and across belief or faith, right? It'll be multiple beliefs and faiths represented. But the point is that we are going to create a strategic plan on how to roll out educational offerings, interventions, studies, and other things in Genesee County that will help equip us to address racism systemically. Kind of answering an ideal question: what would an anti-racist Genesee County look like, right? It's more for a person to say, well, hey, I'm not a racist, that's okay. But not being a racist is not the same as being an anti-racist. And so how do we then empower the community, the larger Genesee County community, to become anti-racist? The other piece to the resolution that we are operationalizing is working with the health department and then the other departments within the county to ensure that all county employees and all county procedures and those things, that they are assessed to make sure that there are not any bias or discriminatory practices, and that those things are anti-racist, and then making sure that there are opportunities to educate county employees around what it is to be anti-racist, and to first even educate them around racism and how it manifests systemically, whether it's in housing, transportation, education. Think about all the social determinants of health, all those things that touch people's lives every day. Many of those sectors have historical racist policies and procedures or histories. And so how do we then educate people working in those sectors? And then how do we do the critical assessments needed to ensure that policies and procedures in those sectors are not continuing to perpetuate racism? And if so, then what's the methods to change or impact that?
I'm glad that you brought up housing and things of that nature. One of the things that and you could correct me if I'm wrong or not, one of the things that I respect about Michigan that they just passed is the clean slate law, because one of the things that discriminated against a lot of people of color with as far as getting housing was their background, was their criminal record. And now and some of these felonies that these individual possesses were 10, 15, 20 years old. And it's kind of hard for an individual, even when Abraham Maslow conducted his research, when he came up with the 5 ways of trying to bring about some resiliency in the individual, his first step was safety, which included housing. And if an individual are not properly going to know where they're going to lay their head at, or where their next meal come from, any resolution that we trying to feed this individual, we might have a challenge with trying to get them to process it, because their mind focuses on, how is my physiological needs going to be met?
Well, that's even in the scripture, Pastor Lee. Yeah. Jesus said, before you preach to a person, if they're hungry, you got to feed them first. So there's certain human needs that must be met before we can really have these deeper conversations around social issues. And so when I think about specifically this policy, we're at the point now of starting to form a community action council, as well as so that they can be instrumental in helping to develop a strategic plan. There will also be some town hall / community dialogue sessions that Community Roots would lead for us and facilitate, as well as Dr. Lisa and I will be doing some focus groups. And all of those things are designed to first build a draft of a strategic plan in operationalizing racism as a public health crisis, but then to make sure that the community's voice is at the heart of the development of that. and then also the refining of that. And then that strategic plan itself will be a living document, and it will evolve. Another thing that we're doing is we're going to put together a repository of anti-racist curriculums, information, models, frameworks, you name it, products, whether they are books, whether there are, you know, TED Talks, things that people can listen to and utilize. Because our hope is that we don't necessarily have to reinvent the wheel, but maybe adapt and tailor something specifically from Flint. Because people have been working on racism for generations, even before I was born, have been doing anti-racism work and those things. And so we're going to also do that. And more importantly is that this is something that has really caught on across the nation. Currently, to date, actually, as of November 23rd, USA Today newspaper wrote an article stating that racism was declared as a public health crisis in 145 cities and counties across 27 states. You know, and so this is something that has caught on across the country. This is something that is important for that many different municipalities to have made that declaration. And so I have been personally kind of mentoring some efforts. There are individuals, whether they're through the Robert Woods Johnson Foundation fellowship that I was in, or others across the country, who are doing similar work and saying, hey, Dr. Key, we saw how you did that. Can you help us? I've been doing presentations. I've been doing training meetings. I've been doing, you know, people have been calling me to get consultations around how do you do this? We want to do it here where we are. And so people are looking at Flint and looking at us as a model and looking at us as a best practice for them on how to get this done. And so that's why we're one of the first groups who are at that next level of already creating a strategic plan to operationalize it. And then that will be something that we can then use and then also share with other groups who may have it on the books, but maybe that's all it is on the books. Then hopefully we'll be able to be a best practice and a support for those organizations or for those communities and municipalities to see how we were able to move it forward and share some of the lessons learned that we have put in place here in Flint.
And I'm glad that you stated that, because that leads us right into our last question of this here dialogue. It said, if someone else wanted to come along and put forth another public health resolution in the county, what advice would you give them? You know, how could somebody, you know, become a part of your team, or how could they create their own, you know, whatever? So what would be your advice to that?
Well, the first thing is make sure that it's going to be community driven. Make sure that the community is in support of what you're declaring, and make sure that you clearly see the impact to give rationale as to why you need the resolution or why it's important, but also the impact of by declaring this resolution, it will benefit in what ways, right? So you want to show the impact, the need, and the benefit, but at the same time, it has to be supported by community. It has to be a community-driven resolution. And then you must be organized, you must use your social capital, and then you must be able to clearly create synergy across sectors and across disciplines and across leadership in the county, so that you will have the right influential voices who are also in agreement. Because we know if community just says something alone, sometimes we can be ignored. And that's what happened with the water crisis. Community was marching and protesting way before the world found out about it, but their voice was ignored. And so making sure that you have community voice strategically galvanized and organized in such a manner that you have multiple layers of community representation, not just the activists alone, not just the community-based organizations alone, not just the churches alone, not just the elected leaders alone, right? Not just the business leaders and the leaders of sectors, but that aggregation of all of those collectively, I think gives greater weight to issues and more gravity to the situation.
I like that because when you mention the word synergy, and that's going to be the main, I think that's going to be the main focus point is establish some type of synergy, making sure that it's felt on both sides. And when it's felt on both sides, that's how you encourage individuals to hear what you're saying. And a lot of us, and that's one of the things that I respected about a lot of the protesters that I observed in Flint, is that they were more focused on getting people to hear them instead of being radical. And when you said that, because that's how things change. I am for protesting, but I am for protesting for a reason. I'm for to bringing about a resolution to the situation. I'm not just to show that, hey, we can come together, hey, we can do this, and hey, we can do that. It's all about bringing some resiliency to the situation. And one of the things about how you bring resiliency to the situation is establish synergy, make sure that it's being felt on both sides. And so that's going to be one of the greatest focus points, that we make sure that moving forward, that everything that we do, it got to be felt on both sides. Because see, I'm gonna tell you something about when I study racism, when I study hate groups and things of that nature, well, my conclusion is this here, that racism and hate groups, some of those groups are against any nationality that's against what they stand for, even if it's the same color skin. And so
racism is all about a value system.
Yes,
and so whether one group or classification of individuals assign themselves a greater value and someone else a lesser, and that's really what drives all the isms, but particularly by race, it's assigned based on your culture and ethnicity. And it can be the same thing with ableism or gender, sexism, assigning a certain value greater because of what sex you are. And so most isms are that because someone disagrees with a philosophy or can be viewed as a threat to the livelihood or the power structure that people have created in their head. The other piece behind things that you need to make sure that you have in your resolution is that, and this is a big some advice, is make sure you know what your ask is, right? Don't just declare the problem, but then what are some of the things you're proposing as actionable steps towards a solution? Making sure that, like you said, not just marching in the streets to be marching, but marching for what? What is the ask? What is the thing that we want to resolve? And then how do you propose we start? You may not have the full answer, but how do you propose we get this resolution underway? What are those things that we can do as a community to move us towards that solution? And so making sure you know what your ask is, right? And then making sure that you show the win-win. How is it a win for everybody? Not just a win for one group of people, but how is it a win-win for everyone?